Okay, we'll go ahead and get started. Hi, everyone. Thanks for joining us today. Before we start the actual presentation, I'm going to hand it over to Alejandro, who will provide our language justice statement.
Thank you very much. Hello, everyone. This is Alejandro Arrieta. I will be the English-Spanish interpreter in this space. I'm going to introduce myself in Spanish, provide some instructions, and then I'll come back and repeat them in English for everybody else. Hola a todos, gracias por tenerme aquí con ustedes. Mi nombre es Alejandro Arrieta, voy a ser su intérprete en este espacio el día de hoy. Si usted prefiere participar en español, va a poder seleccionar el icono terráqueo que va a aparecer en la parte inferior a mano derecha en su pantalla, es como un mundo. Si no lo ven ahí, bueno, todavía no lo van a ver porque no lo hemos encendido, pero al hacerlo, si no lo ven, busquen bajo el menú con los tres puntitos que dice más, y ahí también va a poder escoger la interpretación. Voy a repetir estas instrucciones en inglés, de ahí prendemos la interpretación y vamos a comenzar. All right, thank you for your patience as I provided those instructions in Spanish first. In this space, we do want to work towards language justice as much as possible, so we want to make sure everybody can engage in the language of their heart and the language of their preference. If you are not fluently bilingual in both English and Spanish, you will also select your language. You won't see this quite yet, but once we turn on the interpretation, you'll see a globe icon on the bottom right-hand side of your screen. If it doesn't pop up there, check under the three-dot menu that says More. Either way, once you do see the interpretation, select English. And if you have any issues with the audio, let us know in the chat as soon as possible. Si tienen algún problema, nos avisan en los mensajes de chat, pero con eso ya vamos a aprender la interpretación para comenzar. So with that, I'll pass it back over to the team to turn on the interpretation.
Great, thank you. And I'm going to hand it over to Mike Medwick, who's the host, to do the interpretation. Mike, are you able to do that?
Yeah, one moment, please. Okay, we should be good.
Yes. Okay, we're going to go ahead and start the presentation. Are folks able to see this? Oops. Can I go ahead and get like a verbal yes if folks are able to see this?
Cannot see it.
You cannot see it?
No.
Huh. Okay, hang on 1 minute. What about now?
We can see the full thing. You need to, yep, there you go.
Okay, perfect. Hi, everyone. My name is Elizabeth Everett. I am the Deputy Director at First Five Nebraska. First Five Nebraska is a statewide public policy organization focused on supporting policies that provide quality early care and learning opportunities for our state's youngest children. I am joined today by my colleagues, Katie Bask, the Policy Research Manager, and Sarah Howard, another policy advisor. We look forward to discussing with you today the bills that will impact children and families in Nebraska that have been introduced at the Nebraska legislature. So at our last policy call, we left off by discussing the expectations for the first day of session. So we will go ahead and recap what happened on the first day, especially as it relates to early childhood issues. So the first day, we had speaker and committee chairs elected. The ones of importance are listed here. We had Senator John Arch, elected speaker. We had Senator Brian Hardin, elected HHS committee chair. Senator Dave Merman, elected Education Committee. Senator Brad Von Gillern, elected Revenue Committee chair. And Senator Clements, elected Appropriations Committee chair. All of these senators, First Five Nebraska has a relationship with, and we're excited to work with them on childcare. Most of the bills that will be introduced have been referenced to one of these committees. For the most part, you will see bills referred to the HHS committee or the Education Committee. We do have a couple of bills that have been referenced to Revenue Committee, and very rarely, but we do this session, have a few bills referenced to committees such as the Business and Labor Committee or the Banking, Insurance, and Commerce Committee. So that was the first day of session. Since that point, the senators had spent the first 10 days introducing bills. Nearly 730 bills were introduced, and so 730 bills and constitutional amendments were introduced this session. With that came a host of bills impacting children and families. The first day of hearings happened on January 21st. So we actually had a couple of our bills have hearings last week in the HHS committee. And then this week, this week, morning floor debate will begin. Before I hand it over to my colleague, Katie Bass, I do want to just emphasize a couple of points. As early childhood advocates, we do strive to advocate for different policies in different ways. We support these policies by introducing letters, by testifying in support, or by simply posting on social media. For us, supporting bills come in a variety of different ways and can come differently depending on the preference of the senator. So sometimes a senator will ask us to come in and support a bill. Sometimes they will just ask us to testify on a bill. If it's a bill that First Five Nebraska has been working directly with, we will most likely run the hearing and run the bill for the specific senator, which means that we will work on getting the testifiers, we will work on getting it passed and through the different legislative stages, and hopefully get it across the finish line to the governor's desk. So when we go through each of these bills, First Five Nebraska will discuss our general position on these, and we will let you know kind of where we are in terms of testifying or submitting a letter. But especially as advocates, we do want to stress the importance of just emphasizing that there are very different ways of supporting early childhood bills, and we encourage everyone to do it the way that they seem most appropriate. So I'll now hand it over to Katie Bass to discuss the first tranche of bills.
Thank you, Elizabeth, and good evening, everyone. Excited to have you all on here to discuss the early childhood legislation related to child care subsidy that was introduced this year. The first bill is LB 13, which was introduced by Senator Michaela Cavanaugh. And what this bill would do would be to require the Department of Health and Human Services to amend our Child Care Development Fund state plan so that child care providers accepting the child care subsidy would be reimbursed based on authorized enrollment instead of our current plan, which is by attendance with 5 days per month allowable where a child could not be in attendance. And this is something that First Five Nebraska does support. And we've heard from child care providers across the state for a long time about the importance of enrollment-based reimbursements. This is also something that is required federally, but Nebraska has a 2-year waiver to implement. First Five Nebraska did testify in support of this legislation at the hearing that was on January 22nd, so last week. The next bill is LB 71, and LB 71 is again around child care provider reimbursements, and this was introduced by Senator DeBoer. This bill specifically looks at the rate enhancements that are received when a provider enrolls in Step Up to Quality. Currently, when a provider achieves Step 3 in Step Up to Quality, they receive a 5% increase on their subsidy reimbursement. And then they will receive another 5% increase at step 4 and a third one at step 5. We have heard from providers that there are increased costs associated with improving quality and reaching step 3. So Senator DeBoer has introduced this bill to begin those reimbursement enhancements when a provider achieves step 2 in step up to quality. LB 95, the third bill here, was introduced by Senator Frederickson. This bill is very similar to last year's LB 856 in that it would allow broader access to the child care subsidy program for the child care workforce. There are some key differences this year. This bill would provide a pilot program. So there is a 3-year window for participation that would run from October 1st, 2025 to September 30th, 2028. There are also limits on participation based on the household income. So anyone who works in childcare would be eligible for subsidy if their household income is at or below 85% of the state median income, which is substantially higher than our current eligibility of 185% of the federal poverty level. We'll move on to the next group of bills. LB 304 was introduced by Senator DeBoer, and I know several of you on here have heard me talk about the study that First Five conducted around expanded income eligibility that was introduced in 2021. And this that original legislation in 2021 included a sunset where expanded income eligibility would expire in October of 2026. Based on the findings of that study and the work that has been done around child care subsidy, Senator DeBoer has introduced legislation to eliminate the sunset and make income eligibility permanently at 185% of the federal poverty level. Should LB 304 not be adopted in October of 2026, Nebraska would revert to 130% FPL or federal poverty level for subsidy eligibility, which would put us among the lowest in the nation. This bill has a hearing scheduled for February 6th in the Health and Human Services Committee. And First Five is supporting this bill. LB 339 was introduced by Senator Hallstrom, and it requires the Department of Health and Human Services to provide a report of subsidy billing, a summary report of providers' subsidy billing for the year in February of every year that would look back over the previous calendar year. We worked with Senator Hallstrom to introduce this legislation after several providers expressed some confusion and perhaps maybe a little bit of frustration around the school readiness tax credit application for programs in filling out that summary report of subsidy use over the year. This will be, I think, a bill where we'll have a good discussion about just some of those administrative burdens around the subsidy program and the ability to get clear information from providers or to providers from DHHS. This bill also will be heard in the Health and Human Services Committee on February 6th. It will be the same kind of hearing group as LB 304 that we previously discussed. The The last bill I'll talk about today in the childcare subsidy realm is LB 442, which was introduced by Senator Spivey. And this bill would establish a state childcare subsidy program that would allow eligibility through 400% of the federal poverty level. So again, current participation for the federal and state partnership on childcare subsidy is set at 185%. So this would really expand subsidy broadly for the population of folks who really struggle to cover that child care expense, right? We know that those expenses go beyond low-income families, that it is a difficult expense for many families to manage. And we are supportive of expanding subsidy to this group, and we're supportive of this bill. We do anticipate, though, that between a tightened budget that Elizabeth will talk about later, and that this bill would create a new tax, there will be some resistance to this bill overall. But we are in agreement with Senator Spivey that this is an important step, and we're excited to have this conversation about expanding subsidy access. Elizabeth, I think that's it for me, so I'll turn it back to you.
Thanks, Katie. So the next group of bills that we will discuss have to do with the child care workforce. So these bills, we believe, will have a direct impact on the child care infrastructure. It'll also, though, impact other parts of our state's workforce. So LB 51 was a bill that was introduced by Senator Ibaugh. It is a bill that was well, essentially reintroduced because she introduced it last year, but it did not move. This bill would adopt the National Crime Prevention and Privacy Compact, which essentially assigns us onto what's called an interstate compact so that we could share background check information among various states that are also part of this compact. For us, we're thinking through the lens of what kind of an impact would this have on the childcare fingerprinting issue? And would this help support the childcare workforce if a specific individual moves between states and needs to have information readily available when they apply for their background check? This specific bill had its hearing in the Judiciary Committee on January 22nd, and we submitted a letter in support. LB 363 is another bill that was reintroduced by Senator Ibaugh. It's Adopt the Apprenticeship Grant Act. So this specific bill provides a grant program for people on economic assistance who are trying to continue and pursue their training and credentials through an apprenticeship program, and allows them to use some of the funds for childcare expenses that they may incur. This specific bill does not have a hearing yet, but we will be submitting a letter in support when it does. The next group of bills will impact childcare programs and operations, so really the infrastructure of childcare. The first bill, LB 248, was introduced by Senator Sanders. This specific bill would exempt certain programs from childcare licensing requirements. So it would exempt programs that are on childcare programs that are on military bases or facilities, or on facility bases, or on federal facilities or federal at a federal building from being required to be licensed under the state's Child Care Licensing Act. Right now, those specific programs can be licensed under the Department of Defense. So this basically would allow them to not have to be licensed under both. Our specific concern around this bill is the language around family home providers. So right now, like I mentioned, it would exempt those programs from being licensed if they're on military bases, on federal facilities, or again, off base and run by military personnel. But the language around family home providers is a little unclear. It states that if you are a family home provider and licensed by the Department of Defense, you would also be exempt from the Child Care Licensing Act, which for us raises a little bit of concerns around liability. So for instance, could this apply to every family home provider, even if they are not a military spouse providing care for children? Could this apply to family home providers both on and off base? These are some things that we just want to get some clarification around prior to making a decision around how we will come in on this specific bill. However, we do understand Senator Sanders' positioning on this. Offutt Air Force Base is a very strong component of Nebraska's economy. And for us, we understand that especially as a military spouse or military families trying to start a career or continue their career, having to jump through multiple hoops can be challenging. So providing any type of streamlining assistance is needed. So we do not disagree with the concept. We just want some clarification around the specific language for family home providers. This bill will have a hearing in the HHS committee on February 5th. The next one has to do with liability coverage. So LB 274 was introduced by Senator Hunt, and it would change the requirements under the Child Care Licensing Act for liability insurance cover and inspections and investigations. So it would change the current statute that says that child care programs are required to have $100,000 of insurance coverage per occurrence, and it would change it to $200,000 per occurrence. It would also require the Department of Health and Human Services, when they do those unannounced visits, to request proof of liability coverage upon every visit. If the child care program cannot show proof of liability coverage, they have 3 days to get into compliance before their license is suspended. Now, we know why Senator Hunt introduced this bill. She introduced it on behalf of parents if their child is in a care situation without liability coverage and if an unfortunate incident happens, they want to make sure again that the parents are protected. But at the same time, we also know that this doesn't really address the issue that's surrounding providers with a child with liability insurance. So for us, we will most likely be coming in a neutral position, and we will be highlighting the issue around liability coverage, why premiums are so expensive, why it's so difficult for childcare programs to get liability coverage to begin with. Our hope is that we'll be able to shed some light on the issue, and thank Senator Hunt for introducing a bill that supports families. This specific bill has a hearing in the HHS committee on February 5th. The next group of bills is around safety and security. I keep laughing because there's just a ton of bills. There are a ton of childcare bills this year. But this group is around safety and security. And so safety, not only physical safety, but also having to do with health safety. So the first bill, LB 162, Adopt the Child Care Safety and Security Act, was introduced by Senator Juarez. It would allow those communities, specifically ESUs, to apply for grants if they are interested in providing some sort of emergency response protocol, trainings, or resources so that childcare programs can get notified in a timely manner of emergency situations, such as an active shooter, a weather-related incident, and such. If they are awarded the grant, an ESU is able to work with community partners to create an emergency response protocol. It is a voluntary emergency response protocol that's voluntary for providers and voluntary for community members to participate in. This specific hearing is in the HHS committee on January 29th. This bill is a reintroduction of a bill that was introduced last year by Senator Walz, who termed out. First Five Nebraska came in and support then, and we will testify in support at the hearing tomorrow. is tomorrow the 29th? Yes. Gosh, time seems to go by so fast. LB 457 is a bill that was introduced by Senator Bostar that would require anaphylaxis policies for school districts and licensed childcare facilities and provide a limit on the amount insured required to pay by insurance policy or benefit for anaphren injectors. Sorry, it's a little late tonight. This specific bill is one that, again, was brought forward to Senator Bostar by a family. This specific bill, and I'll only talk about the childcare portion, would require all childcare providers that serve a child that with a known food or other allergy and does not have a current policy in place to adopt a policy around how to care for that child if that child does get exposed to food and has an allergic reaction or some sort of other substance and has an allergic reaction. This bill also requires the Department of Education and Health and Human Services to work together to create a model policy on what this could look like in case the childcare providers and school districts would like to adopt it. For school districts, they are required to adopt it. For childcare programs, they are not required to adopt it. They're only required to have a policy in place that works for their needs. This specific bill, again, has its hearing in the Banking, Commerce, and Insurance Committee. So like I mentioned before, this is a rarity for us. We normally don't have bills in this specific committee, but because of the insurance policy language, it was referred here. So this specific bill will have its hearing on February 10th. The next bill these next set of bills have to do with accessibility. So making sure that families have access to care. So LB 74 would authorize certain expenditures under the Nebraska Accountability and Disclosure Act, Nebraska Political Accountability and Disclosure Act, to be used for childcare purposes. So this specific bill, for instance, would allow those individuals in state office to use some of their campaign funds for childcare expenses if they were incurred while that individual was performing their duties. This specific bill is, again, we're going to come in and not testify, but submit a letter in support, is of interest to us because it does highlight the fact that accessibility does not only impact those families who, again, are low income and don't have access to care, but it also impacts those state senators who some might assume have more money, but they make $12,000 and also don't have the same type, are also struggling with getting access to the same forms of care. LB 94 would adopt the Digital Skills Empowerment Act and change the use of the Workforce Development Program Cash Fund. This specific bill was introduced by Senator McKinney. It would allow individuals from between 100 and 200% FPL and qualified census tracts to obtain digital skills certifications and use some of the funds provided through this cash fund through this specific program for childcare expenses. So again, it's encouraging and helping those individuals as they continue to move up in their economic success, help them have access to quality childcare so that they can continue and support their families. This specific bill, again, has been referred to a very unlikely committee, the Business and Labor Committee, but one that we, again, don't normally go in front of, but it will have its hearing on February 3rd, and we will submit a letter in support. I think these are the last set of bills. This is around budget and taxes. So LB 157, adopt the Child Tax Credit Act. This specific bill was introduced by Senator Conrad. She is modeling it off somewhat after the federal refundable tax credit that was available to families during the pandemic. But it would provide a $1,000 refundable credit per child birth to age 5. And the amount would lower depending on your annual household income. So as you continue to go up in household income, the amount would lower by a certain percentage. This specific bill, again, we will submit a letter in support because like we know, access to care comes in all forms and requires not only the family to be economically stable, but also have access to transportation, food, housing, and funding that could be provided through LB 157 could be used for those purposes. LB 161 was introduced by Senator Juarez. It would redefine formula students under the Tax Equity and Educational Opportunity Support Act, also known as TEOSA. So this specific bill would change the weight of pre-K students from 0.6 to 1.0. We will be sitting in the chair, so testifying in support of this bill and highlighting how important it is to consider those pre-K students with the same weight as a child in kindergarten through 12th grade. For us, quality care is not dependent on age. Everyone should, again, those children, those pre-K students, providing additional resources to those school districts could mean a great deal as they continue to support the care and needs of those children. Another thing that we will be highlighting, though, is the fact that while this is a great step, we also want to make sure that those school districts that are unequalized also get access to the early childhood state aid. So right now, only the equalized school districts do get that, not the unequalized school districts. 182 was introduced by Senator Bostar. It was changing provisions around the Affordable Housing Tax Credit Act and the Child Care Tax Credit Act. So again, I'll only speak about the Child Care Tax Credit portion. This part of the bill would change certain language that was passed in LB 754 back in 2023 that would allow banks and insurance companies access to the non-refundable tax credit of the Child Care Tax Credit Act. Right now, they're not able to access this tax credit because they are not subject to the income tax. Financial institutions are subject to a franchise fee, and insurance companies are subject to a premium and other retaliatory fee. So this language essentially just allows them access to it. Nothing else changes. Because there is no fiscal note and because it was such a simple bill, the committee had its hearing on January 24th in the Revenue Committee, and they actually exec on it that day. So it's now on general file, the first stage of debate. Oh, I thought I was done. The next set of bill is the same group, budget and taxes, LB 264. This is actually one that we will come in and oppose. So every year, the governor, the legislature has basically 3 budget bills. There's the mainline budget bill. There is the bill that's specifically around cash funds. And that's LB 264 is the one specifically around cash funds. There is a ton of different things in this bill, but the section that we're specifically interested in is the one having to deal with the Early Childhood Education Endowment Fund, also known as sixpence. So this bill does strip $3.25 million away from sixpence's cash fund and puts it towards the Education Futures Fund. So for us, setting a precedent of moving any money out of a critical program such as sixpence that provides care, different types of care to those children most at risk, birth to age 3, should not happen. So for us, we will be coming in opposition along with several other organizations opposing different parts of this bill. And now LB 710 is the increase the earned income tax credit. We will be submitting a letter in support of this bill. The bill has not been scheduled yet. Senator Bostar introduced this bill, but it would increase the matching rate Nebraska makes to federal earned income tax credit from 10% to 20%. And now I am going to hand it over to Sarah Howard, who will discuss our maternal and health issues along with our home visitation bills. Sarah?
Thanks, Elizabeth. Go take a little break. So hi, everybody. I'm Sarah Howard. I'm a policy advisor at First Five Nebraska, and I focus on maternal and infant health policy. So the next few slides are just going to be about healthcare access and moms and babies. And so I wanted to start with our home visiting efforts because we've been working on home visiting for a few years now, and we've really been building a groundswell of support inside of the legislature for home visiting programs. And this year, we have 2 bills that we're asking the legislature to consider. The first bill is LB 22. It was introduced by Senator George Dungan from Lincoln. And it asks the Department of Health and Human Services to file a state plan amendment to Medicaid so that we might be able to bill for the service of evidence-based nurse home visiting. The issue here is that last year, we were able to get some funding in the budget for evidence-based nurse home visiting. And all of that money ended up going to Douglas County. Currently, the only evidence-based nurse home visiting program available in the state of Nebraska that's up and running is in Lincoln, Lancaster County, and that's a program called Family Connects. Family Connects offers new parents who are leaving labor and delivery, so at discharge from labor and delivery, they're offered 3 to 4 visits in the home with a nurse. The only way that I could think of, and I've been doing policy work for a while, for us to be able to allow every mother in the state the opportunity to have these nurse home visits offered to them after they bring a newborn home was to have the service be billed by Medicaid. So last week we had a hearing in the Health and Human Services Committee for LB 22. It went really well, and the committee seemed very receptive to the idea of supporting new mothers and young families with this service. I'll keep you posted on how it goes from here. The second home visiting bill that we have is LB 104. This is Senator Ray Bould's bill to adopt the Family Home Visitation Act. This is actually a reintroduction of a bill that she brought in 2023. And what it does this time around is it defines home visiting in statute and calls for an annual report for starting in 2026 and going until 2028. What's odd about all of our policy around home visiting is that it exclusively lives in the budget and in our budget process. And so this new bill, LB 104, would begin to create a statutory structure around home visiting and give us the opportunity to build out and increase access to home visiting through statute. We do have a hearing scheduled for Friday, February 7th for this bill, and we're hopeful that we'll get lots of letters from folks who support the bill. Okay, next slide. Okay, LB 41. I don't like the one-liner on this, but it says to change the blood test requirements for pregnant women, which is what it actually does. But right now in statute, at your first prenatal visit, they'll draw your blood and test it for a variety of diseases, one of them being syphilis. That is required by statute that you do the blood draw. You can always opt out, but it's required by statute that it's offered. And we had been looking and hearing about this major issue with young families, new babies in the state of Nebraska, based on the incredible rise in rates of congenital syphilis in the state of Nebraska. So we've had about an 1,100% increase of babies being born already infected with syphilis. And that can lead to a variety of problems for mom and baby. The baby can be born stillborn. Mom can miscarry, the baby can die shortly after it's born. And so we really we went back to providers and said, what can we do to reduce that rate of infection for syphilis? And the American College of Obstetricians and Gynecologists actually recommend not just one screening like we have in our statute at that first prenatal visit, but they recommend 3 screenings. So first prenatal visit, once in the 3rd trimester, and at labor and delivery. So the sooner you know that a mom or a baby is infected with syphilis and introduce penicillin, you can mitigate all of those impacts. Last week, the Health and Human Services Committee heard the bill and really seemed to get it, which was exciting. They really seemed to understand that the cost of a $12 screen is much cheaper than a $71,000 NICU admission. And so we're very hopeful that this bill will move forward in the next few weeks. The next two bills do not have hearing dates set yet, but I'm very hopeful that we'll get something on the books soon. LB 153 was introduced by Senator Gareka, and this is a reintroduction of Senator Hunt's bill from last year, LB 913. LB 913 did come out of committee last year, but we just ran out of time to move it on the floor because it was a short session. This year, the bill is very similar to the one previously, and it asks DHHS to file a state plan amendment to offer postpartum coverage to mothers who receive their prenatal care through the Children's Health Insurance Program. So you might remember that in 2023, we extended postpartum coverage for mothers who receive their prenatal care through Medicaid for up to a year. However, there's a small population of mothers, about 900 mothers, who receive their prenatal care through CHIP, or the Children's Health Insurance Program. Some of these mothers are undocumented. Some of them are mothers whose who are minors, whose parents' income make them ineligible for other prenatal care. Some of them are just mothers who maybe make too much money or have no other type of prenatal care or coverage. There are about 900 of them, and what the bill contemplates is drawing down federal funding to offer them postpartum coverage for at least 6 months. Currently, all of these mothers lose coverage the moment that they give birth. And so we know with research about the 4th trimester and how important that postpartum time is for mom and baby, offering postpartum coverage in this manner is a great idea, in my opinion. So we're hopeful that we'll get an early hearing on this and we can move it forward again. The last bill that we're sort of in charge of around maternal and child health, and then I'll just talk about 3 that we're keeping an eye on. The last bill that we're in charge of is LB 446. This is also with Senator Gareka, and this is around maternal and child health data. So for the past few years, First Five has really focused on how do we make sure that we can access maternal and child health data, not just for research purposes, but also to make sure that policymakers are making good policy based on solid data. What we discovered was a challenge inside of our access to vital records statistics, and we brought it up in an interim study hearing over the summer with Senator Day. And just days before that hearing in September, the state actually released a vital statistics data dashboard. And so LB 446 does 3 things. 1, it codifies that dashboard, puts it into statute, and calls for it to be updated on an annual basis. 2, it allows for an application process for researchers that is clear and expedient, which is something that the agency says that they're doing, but we want to make sure that that's in statute and required by law. The last thing it does is it allows quality improvement collaboratives, like the Nebraska Perinatal Quality Improvement Collaborative, access to aggregate, de-identified vital statistics data to help them in their work of improving outcomes for moms and babies. This one also doesn't have a hearing, but we're very hopeful that it'll come very soon. Okay, next slide. All right, these 3 I have a little cheat sheet on, but these 3 are ones that we're watching because we know that maternity leave, paid family medical leave, these and express lane eligibility are all pieces that can improve outcomes for families and just make their lives easier, right, when they're going through a hard time. So I'll talk about LB 189 first. This was introduced by Senator Michaela Cavanaugh. It adopts the Paid Family and Medical Leave Insurance Act, using funds from the Healthcare Cash Fund. The reasons that you would be able to use paid family and medical leave include having a new child or taking care of a family member, pregnancy, or a serious health condition. Within the bill, there is a maximum. So the maximum amount of leave is 10 weeks consecutive or 60 days intermittent. We're just keeping an eye on that bill. The next bill is LB 224, and that is Senator Gareka. And it is just what the one-liner says. It requires paid maternity leave for state employees of Nebraska, and it outlines that that leave is 12 weeks, which is great. The last bill is from LB 283. That is Victor Roundtree, and it requires the Department of Health and Human Services to implement express lane eligibility. Express lane eligibility is something that has been contemplated many years in a row at the state level, but basically what it is when you apply for one program like SNAP, they would be allowed to share your information on the Medicaid side to essentially express lane you into eligibility for Medicaid and vice versa. So this would really help with families who right now have to fill out 2 applications, one for the Supplemental Nutrition Assistance Program, or SNAP, and the other one for Medicaid. It would allow those 2 programs to share information and help reduce the burden on families in terms of paperwork for applying for those necessary programs. I'll stop there and pass it back to Elizabeth, and I'm happy to answer any questions you might have at the end.
Thanks, Sarah. So before I go into kind of some dates that are important, I do want to caveat that there are a ton of childcare bills and maternal and infant health care bills introduced this year. Our hope is to get as many passed as possible, especially the ones that First Five Nebraska are specifically working on with senators. But unfortunately, with the fiscal outlook and the budget the way it is right now, it might be a little difficult. So any bill with a fiscal note will have a hard time getting passed, and the ones that request a lot will be even harder to get passed than those that, again, like the 182, have none. So for us, again, we're going to do our best to get as many bills passed. Our hope, though, is especially with this new group of senators, is to really engage and to gather a new group of advocates so that as we continue this process of educating and encouraging these senators to support early childhood issues, we'll build advocates that will want to introduce bills next year, even if they don't pass this year. So with that, I'll go over a couple of dates and then hand it over to my colleague JR, who will talk about advocacy. So the next policy call will be February 11th. We are having these policy calls every other Tuesday at 1:30 p.m. and 7 p.m. Our hope is that at 1:30 p.m. we'll be able to hit those organizations and those childcare providers or employees that are maybe during their lunch break, and then the evening call to hit those family home providers and other employees who might not be able to get away during the afternoons. They will be the link for the policy calls, and the recordings, along with the PowerPoints for the policy calls, will be on our website. There will be, you will see actually right on the front of the page, it says FFN priority, excuse me, it says FFN policy calls. You'll be able to click there and then scroll down and either register for the next call, which is actually already up and running, or look at the previous call, which we'll go ahead and post this by the end of this week. March 13th so again, moving on down the list of important dates. As we proceed with hearings, March will be an important date when it comes to assigning priority designations. So again, speaker, senators, and committees get priority designations for bills. Priority designation means that this is the most important issue for that specific senator or speaker or committee. So our hope, again, is try to get a couple of our bills prioritized. But March 13th will be the deadline to request a speaker priority. March 14th, we will be notified of what the senator and committee priority bills are. March 28th will be the final day for public hearings. And then March 31st will be the full day floor debate. So like I mentioned, January 29th, morning debate begins, and then in the afternoon, it will be hearings. March 31st will be full day floor debate. And as always, if you are ever interested in learning more about advocacy, we would encourage you to reach out to our colleague, JR, and I'll hand it over to her.
Yeah, thank you. I do see that there's a couple questions in the chat. Elizabeth, I don't know if you want us to knock those out first.
Why don't you go ahead and just kind of mention kind of how people can get involved, and then we'll answer the questions.
Perfect. Yes. Hello, my name is JR. I am the Advocacy and Grassroots Advisor for First Five Nebraska. And as Elizabeth mentioned, there are a number of bills up this year, both for childcare and for maternal health. which is great because that means that those of you that have been doing the grassroots work have really started to build that momentum and movement within your communities. And now we're seeing it begin to take hold as something that is a much more public conversation. So we thank you for that work and want to continue to work with you to make that happen in a way that can change policy. So given what a full docket we have and knowing that we're trying to jockey for some priority, and also because we're in an interesting and tight budget year, we want to be as strategic and thoughtful as we can. So in that regard, it's really going to be about collaborating, making sure that our messages are clear and credible. And so that's where we want to support you, is to make sure that you always have the best information to speak on the bill, to write a letter. If you're interested in getting involved in other ways, we all have different ways of bringing our gifts and personalities to the advocacy stage. So with that being said, I'm going to drop a form into the comments here. If you're interested in getting more involved in the legislative part of advocacy that we're going to be focusing on for the next couple months, if you wouldn't mind jumping on there and just letting me know about your interest, but also about what part of the state you're located in. There's already some great movement happening in various parts of the state. And, you know, back to that idea of being coordinated, I would love to connect you to some advocates and partners that are doing really good work to really organize, to really make sure that everybody's involved, and to make sure that we're really speaking from a strategic and credible place. So I would love to get you connected to that, and then also to find out how I can support you in your advocacy. So please feel free to use that link to the very short form, or also you can always text me at the number that's there. Sometimes that's the fastest and easiest way to reach me. So I am looking forward to working with you along the way. I'm going
Thanks,
to hand
Jan.
it back to Elizabeth.
Thanks, GR. I see there's a couple of questions in here from Betsy. Thanks, Betsy, for your questions around the fingerprinting. So for this session, the bills that we discuss are going to be the bills that will be available, right? So the bill introduction period has ended. There will not be an opportunity to introduce another bill to support the fingerprinting issue. For us, though, Senator Ibach continues to remain committed to addressing this concern. When the legislative audit did come back, it highlighted again the kind of inefficient system that the department utilizes and how additional supports and resources are needed to make it streamlined and more efficient. For us, that does come back actually to your bigger question around the budget. And so with the fiscal climate and budget cuts continuing to happen, I don't see improvements to the system until we're able to probably fully staff it, two, improve the system that they currently operate in, and then, three, providing the necessary training and supports that are needed for staff to get those fingerprints kind of turned around, especially the paperwork turned around so that childcare providers are informed in a timely manner. So unfortunately, right now, there isn't a bill that will address this specific issue, but Senator Ibach remains committed to it. Yes, I know the 5-year cliff will be huge. This is something, I mean, truthfully, this is probably something that we have ongoing conversations with the department on again. And JR continues to engage advocates on this, especially because it remains a top issue. So, Betsy, I would love to, again, kind of talk, maybe we can talk offline about some of the things that you've been experiencing, but I think it's probably safe to say that we will, remain committed and continue to push forward with the department and hopefully try to find some sort of supports for it. But right now, it is very hard to get any sort of resources. Other questions? Okay, well, if there's no other questions, thanks for joining us tonight. As always, if there are different things that you would like to, also truthfully, if there's feedback or things that you would like us to talk about on these calls as well, we would love to hear that. These calls are, intended to provide information to you about what's happening at the legislature. But if there's ever questions or thoughts around how these calls could help differently, or how they can be structured differently to support your needs, please let us know. And please reach out to JR to let her know, okay? But thank you again for joining tonight and have a wonderful evening.